Good morning, class. I'm Miss Precious Suzuka. I'll be taking you through our community nursing class, where we are going to be talking about tuberculosis today. Yes, I'm seeing everyone is in. Yes, is in class. I hope you are ready for the class. I hope your notes are ready and everything. Before we begin, does anyone know what TB is, or tuberculosis? Okay, thank you for your answers. Let's dive into our lesson for today. Our learning outcomes today are, at the end of this lecture, students should be able to define tuberculosis. We are going to talk of signs and symptoms of TB. We are going to talk of the types of TB, as well as factors contributing to the spread of TB. We have already heard from our colleagues what they think TB is. So TB is an infectious disease of the respiratory system, affecting mainly the lungs. The germs that cause the tuberculosis are a type of bacteria called Mycobacterium. Are we together, class? If I'm too fast, please stop me. If I'm too slow, you want to sleep, indicate so as well. Signs and symptoms of TB. TB may present with a couple of symptoms, however, they are most common ones, which are productive cough, weight loss, lymph node enlargement, fever, and sweating. With the lymph nodes, it's not a matter of palpating, but they will be easily be visible. And then sweating is not a normal sweating, but it's a sweating that presents especially in the early hours of the morning. The sweating will present and it's really too much. Okay, now, what are the types of TB? Class? Does anyone know what the types of TB that we have? Okay, yes. We have pulmonary, and the other one? We have extrapulmonary. So we have pulmonary TB and extrapulmonary TB. Pulmonary TB, this is the type of TB which affects the lungs. Whilst extrapulmonary TB is the type of TB that occurs outside the lungs, any part of the body other than the lungs. It can be in the spine, it can be in the abdomen, it can be anywhere, even in the brain. So this is extrapulmonary TB. What are the factors contributing to the spread of TB? We are going to outline three. We have economic, social, or cultural factors. Where in economic we have poverty, poor nutrition, alcoholism, migration, and low immunity. I'm expecting you to know this as an NB. I might ask them in a test or an exam for you to elaborate more. How does poverty contribute to the spread of TB? Okay, and then we also have environmental factors, overcrowded living condition, access or poor access to services, looking for services, and so on. Institutional factors, insufficient number of trained staff, staff stigmatization as a TB nurse. Some nurses, they are scared to work in the TB departments, and poor management and follow-up if the TB is not managed properly. Okay, so do we have any questions so far before we can do a recap quickly? Okay, so for today's lesson, we defined what TB is as a disease of a respiratory system affecting mainly the lungs. We have outlined or discussed the signs and symptoms. We have also discussed the contributing factors. So if we have heard and have understood this topic, thank you very much. I'll allow for discussion. Any questions? Okay, I'll take your silence as you have understood, so we continue again tomorrow. Thank you very much.